actually, as you do, as one does. And it's a little bit controversial. I wrote it, it was for a fitness magazine. I wouldn't say it was controversial, but it kind of stirred a few people up. And it was about drawing the line. The article, I've written many articles, and the article I wrote at the time, it was for FitPro in the July 2010 edition, and it was about the boundaries of a personal trainer and therapy. So my suggestion was that when I talk about using the skills as part of your remit, where when I wrote the article, it was about in personal training, it can be quite an emotional job because people are going to disclose many things, you know. If someone's training really, really heavily, you'll know that it can be quite emotive, you know, you break boundaries. So for me, the article was insinuating that, okay, there is a sort of fine line between physical training and counselling. Because the personal trainer, you'll know in other professions, like, you know, hairdressing and other things like that, that people do disclose. Personal training because the endorphins are going, that you know, and for me, the article was insinuating that, okay, there is a sort of fine line between the trainer staying to the remit to help the person become physically more fitter, or it could be a goal related to training, and then crossing the line to therapeutic intervention. And that's where I position myself in the article. And the reason being, I think that there are people who are best placed to help people for certain things. Okay, and one should stick to their remit. It wasn't a go at trainers because they do a fantastic job, and I've done conditioning work myself. It was purely coming from a position that, okay, and I wrote the article, and I was on a course one time, delivering a course one time, and someone had read, a personal trainer had read that. I don't think they quite understood what I was referring to, but she said to me, she goes, she has a client that she trains who's got bipolar, and she said, what was my thoughts on whether she'd encourage her to train on days she didn't want to go and train. I said, well, I don't know, because I don't know her, I don't know the situation, well enough to make comment. What I would say, if she's having clinical help, you might want to speak to whoever's treating her for that. If she decides she doesn't want to train on a specific day, rather than you getting on the phone and saying, you know, come on, and with all the good intentions, and we know people have got good intentions, I said, you want to maybe speak to the clinical person? She goes, why is that? That's abandonment. I said, well, it depends how you put it. I said, well, what do you know about bipolar? And, you know, probably other than what she's read in the magazine or see, you know, one of these celebrities come out and say they've had that, not undermining, I'm sure some of them do have that, very little. So I made the point that you encourage her to train, and she manages to get out of bed and get to training in the safety of her own home. If she feels safe there, it might be an avoidance behaviour, something could be going on in her life, biologically, psychologically, sociologically, and she ends up on the street and gets overwhelmed. What do you do then? What do you do if she then decides to do something drastic to herself? Where do you go then? So the position was on the basis that, okay, one should know what one's remit is, and never a good deed goes unpunished. And I think she got the lesson, and that's what I was referring to there, where you can cross that boundary, okay, and say, well, you know what, this is my remit. And the teacher said to me one time, when I was delivering training, one teacher said to me that there's a student that had depression, what would I suggest you do for that? And I said, well, I suggest that you get him a referral to the right person. He's suggesting I don't help. I said, I suggest that you get him to the right person if that's what he has or you think he might have. Reason being, your job is to teach. If you're going to use any techniques, base them on teaching. So for me, I'm going to we'll go into some more detail, but let me sort of give you an idea. Many years ago when I was at Loughborough University doing sports performance conditioning, I was sort of, young, bright-eyed, bushy-tailed, and I had a profound interest in psychology and hypnotherapy and NLP, but I was studying sports performance conditioning. And I had this conversation with a physiologist. It was fascinating. He was a really, really top trainer as well. Fascinating conversation. And I've sort of dug out the article, and we talked about the mind and nature, nurture. And this was back in the day we didn't have Google. He told about this story, the Charles Whitman story. And you can read about it according to Brain Mind. and so on and so forth, written by Gabriel Joseph. But there's other literature out there written about him too. And it's quite interesting, really, in the sense that, one day, cutting a long story short, he wakes up and I think he shoots his wife and mother-in-law, something along the lines anyway, studying his, and then he makes his way to the bell tower at Texas and he starts shooting people. That's sort of the loose story. You can read more of it. But apparently, according to this report, if you read it, a post-mortem was done in his brain and it revealed a glioblastoma, a multiform tumour the size of a walnut, erupting from beneath the thalamus, impacting the hypothalamus, so extending into the temporal lobe and compressing the amygdaloid nucleus. So if that's correct, then there's a possibility. There is a possibility that that tumour could have impacted his behaviour. Now, I don't know the story well enough to know, but what I have read that in the build-up to what he did, he was complaining of feeling angry, irrational, and so on and so forth. So I don't know if he did get counselling, but on one journal I read he did. But you can think that it's debatable now whether that caused a radical behavioural change. But we'd have to be very naive to think that it couldn't, but whether it led him to do what he did, because you could argue other people might have something similar and don't do that. But what I'm saying is that things are multifactorial. Okay, I don't want to open Pandora's box, but I want you to get to think, okay, that things can be biological as well as many other things too. So if that's the case, then no amount of counselling is going to help someone in that situation. If the people who make the point that that could have been influential in his behaviour change, then you can counsel someone all you want. You may come across the Phineas Gage story, and Phineas Gage had an injury at work, and he damaged the prefrontal cortex. Now, cutting a long story short, you can read about it, and a rod went through his brain, and miraculously he survived, but he damaged the prefrontal cortex. Now, what I find fascinating, actually, in my opinion, wasn't what he couldn't do, because many things changed. He emotionally changed, impulsively changed. He couldn't do his job no more. Many things had changed. But what I found fascinating was the things he could do, because apparently he sort of moved, I think, to the other side of the country in America and just became a show piece. So to think that he still had a high degree of functionality, even though the brain was severely damaged, was quite fascinating. But that's sort of my sort of spin on things as well. But the point being is that, so trauma can cause change. Virus can cause change. So for the coach, this is something to sort of take into consideration. There's a fine line really between clinical and coaching, and it's very difficult to define. I've heard many people define it in their own way. At the NLP conference last year, I was watching another NLP trainer speak, and they sort of said, well, coaching is like 80% moving forward and 20% dealing with the past, and clinical is the other side. I don't know if that's true, and I don't know how you would quantify that, but what I do know is, for me, it would be more along the lines of, okay, understanding things like safeguarding and being switched on to know, what can I deal with going forward. Now, there's a grey area, because I know in football it was difficult because you had players who had issues, like gambling and other stuff as well, but you had psychologists dealing with performance goals. So where do you draw the line between a performance goal and an issue they might have? And I always say to psychologists at the clubs there, okay, if in doubt, then send them to the referral. If in doubt, if you're not geared up for that, it's an issue around gambling, but then you uncover something else, or if that's the issue, then send them to the appropriate person, one would think, because your job is performance related, one would think. So it's not easy, but it's food for thought. Okay, so the biopsychosocial model was proposed by George Engel in the late 1970s. According to Engel, health, wellness, disease are dependent on the interaction between three factors: biological or physiological factors, psychological or mental factors, and social factors. So that was his proposal. I think from what I read between the lines and reading some of the articles, read some of these articles out there, these research papers. Now, in this paper here, the advantages by taking account of cultural, social, psychological considerations, biological, it avoided the polarisation of the medical reductionists. At that time, because psychology is still new in one sense, to a point as a field, there was still that polarisation amongst medical people around the mind and conditions of the mind. So I believe after Ludwig's paper, there was like a comeback. And the way he would go around doing that was, okay, we'll tie a biological element to psychology. Because you had a biomedical model prior to that. So I think that one way around would be, okay, let's take that in consideration too. Because at that point, the credibility, the polarisation the medical reductionists had could be quite scathing. It was like someone might have an opinion of why someone had a behavioural issue, and the medical reductionists would narrow it down to biology. Now, we know that it's multifactorial, but it could be that. So that's what I think, according to the papers that Engel was attempting to do. Because the model was based on the systems theory. You can track it back to Paul Weiss and Ludwig von Bantefly, and the theory was the conceptual basis for both biologists who shared a strong desire to overcome what they viewed as mechanicist approach to biology. Two biologists in the 20s, had their own theory, and I think that George Engel model was based on that, and certainly what he will do to look at the sum of all things, the conceptual bias that can be mechanical. Well, this causes that causes this treats that treats whatever, so to speak. So both biologists had a strong desire to overcome what they viewed as mechanicist approach in biology. On the making of the system theory, Paul Weiss and Ludwig, they built a conceptual connection, and in this article, which is quite fascinating article you can read by Drac, Affolter and Pavru, it sort of talks about the systems theory, and then you sort of read that and you start sort of building a picture how George Engels would sort of develop his own model. Now, I think what's challenging about human beings is that we're an open system, where we are an open system, so to speak. So it's hard to make predictions. It's almost impossible to make a prediction, because and we all know someone who smokes, drinks, and does all the wrong things according to research, but they live a long, ripe age. And that's not suggesting that. Now, I saw something on social media the other day about someone who was in their 70s who ate all the wrong foods and did all the wrong things according to research, and they lived a full life to a point. There was someone else who did the opposite. It didn't really work out for them from that point of view. But equally, you could argue too, had the person who lived that sort of life, the first one, and they'd eaten well and did what research says, could they live longer and maybe more better? Could the other person, if they ate all the bad stuff, maybe life could have been shot even more? So there is that to take in consideration. There's many variables. Because you get two people, let's say, two people could do one thing. You could have, two next door neighbours. One is training 4 or 5 times a week, eats all the right foods and does all the right things and everything else that goes with it. And then one of them could eat all the wrong foods and according to what research says and that sort of stuff really. And the two, could be going for a walk, and obviously one thing could happen to one and not the other. From the point of view is the other variables too that could happen. One could have high blood pressure and high cholesterol, but it doesn't make sense why they would have that in one respect. So, it's hard to make a prediction in view of that. And I think for me, researchers can study human action in the laboratory, but you've got to be cautious about making generalisation because it's a closed systemic context, everyday life. What goes on at the laboratory doesn't always go on in real life. So that's the sort of danger from the research point of view. because human beings were quite complex. All living organisms and their actions exist in open systems. Okay, so it's quite multifactorial. Human systems are goal-seeking and adaptive at the individual and collective level. Okay, so we adapt to environment, we're goal-seeking, we look to avoid pain and move towards pleasure. We can study animal models, but how appropriate are they? So you get out of it what you will. You know, how appropriate is studying an animal model? Well, you've got to take it for face value. And point being is that there are differences between the species. So what works for one person might not work for somebody else. So someone would come to me and say, well, they're adamant they got better through an angel healer or a spiritual healer or whatever it is that helped them get better, and I can't disprove that. There's no way of disproving that, but equally I can't disprove Santa Claus too. But I can't prove it either. So it's about having the open mind and not being closed. Anecdotal, and we see a lot of that. You see loads of these days on social media, it's all over the place. And I did this, and I did that, and I did this. And I remember a couple of years ago, it was baking soda all over social media. People say the benefits of baking soda, high alkaline. I'm like, for goodness sake, are these people out of their mind? You take baking soda, goodness, if you've got high blood pressure, it ain't doing any good. Goodness me, I'm not a medical person, but I do know from being an athlete, and many, many years ago, we used to have a little teaspoon. It was perfectly legal in my early 20s to buffer lactic acid. It was very controlled. We drink a lot of water, and I wouldn't recommend anyone else to. We had a great coach monitoring it. It was to buffer lactic acid running up and down these hills. I've run up and down Riverton Mall, as you do, as a buffer, but I certainly wouldn't recommend anyone else do it unless it's really controlled. But if people like putting it out there saying, you know what, it does this, it does that, that's a danger, you know. And I think these things need to take in consideration, you know, like, you know, one thing might work for one person, but not 10,000 other people. You know, you see it all the time. There's all sorts of stuff that hits the market, and it's great people share. A woman on a program the other day, she shared her experience, and I don't know, it was a program, you may have seen it, it was being shared all over social media. Not to comment on it, because I'm not a medical person to comment on it, but what I will comment on was she was saying how, I think it was this cannabis helped her. Now, it may have helped her. Now, I don't know, it's not my field to say what didn't help her, by the way, but what I would say, it's a balancing act, isn't it? Because we do know that, you know, from a clinical point of view, these things, it'd be great if they do research and more, we know more about it. But I'd be very concerned if a young person saw that and thought, you know what, I'll do that. Because there is an ingredient we know in cannabis that has a causal link to psychosis and also schizophrenia. That's not to say everyone who takes it is going to get that, but they could do. And I think that, you know, it's pretty irresponsible for someone to come out there. I'm not saying she was irresponsible, because she was passionate about improving, and it may have been that, may not have been that. Only the medical people will know. But equally, you know, anecdotal is useful to a point, but it can also be dangerous. There's a danger in that. Now, I do know that someone told me that the oil doesn't have the ingredient that causes that, but there is one that does too. So I think for me, you know, when in doubt, certainly, you know, go to the appropriate person. As much as people say that, you know, like to the old conspiracy theories and all that sort of stuff, really, I'm sure there probably is. And certainly when I was doing a dissertation one time, when I was studying a module in psychology a few years ago, I didn't think it was right that people, you know, would sit on various boards from a pharmaceutical point of view, because you can increase the lens. You know, the DCM manual had a few conditions years ago, but now it's got a lot more. So just by increasing the lens overnight, you got 20 more million people. And that's true. I wrote a dissertation on it, and I saw it. I did the research, and that's factual as far as that goes. So that's probably not good either. But the point being is that the human body is an open system. You know, various inputs such as oxygen, food and water, waste, carbon dioxide, their outputs. Energy can be transmitted from kicking a ball, for example. So there's always an exchange of energy. I think what's really important, by the way, is disciplinary imperialism. It's important to know if anybody says to you from any background they claim a privileged view about health or behaviour, then get them out. You know, I certainly anyone tells me that they have all the answers, then the door's that way, because no one has all the answers. If someone says, well, it's my modality is the one, and I was at the conference NLP last year too, and I spoke. One woman was like adamant every young person should be taught NLP as young as they possibly can, and it would change the face of the earth. I said, well, actually, I think the young person should be given love and compassion and a big hug and food and water before anything else, in my opinion. Not one modality has, as much as I am passionate about NLP and other modalities, I don't think one has all the answer. So I don't want to breed fanatics. We don't think fanatics are good for anything. We're fanatic about the yoga, about the fitness, about the NLP, about whatever. It's not a good thing. You have to have the open mind. So no one's got a privileged view, I think. It's about working together. The biopsychosocial, there are many three factors that you consider. Biological, psychological, social factor. It's a combination of factors. Okay? So, the genetic makeup, the biology on health, and this is the nature part, by the way, on health. The biological influences on health and health behaviour include infection, physical trauma, hormones, nutrition. The nature part of nurture, genetic, neurons, hormones, neural communication, endocrine system, nervous system. So that's the biological element. We'll explore in a little bit more detail as we go along. And that's generally more the medical person. If you're sort of coaching, you think, okay, that's more medical person. That's not for me. Or maybe a nutrition person, if that's appropriate. Because I know in certain situations where people have changed things, in certain areas here, like nutritionists work for them. But what works for one person might not work for somebody else. But sort of the genetic makeup is important. And you only got to read research. There's certain papers that talk about genetic factors influencing alcohol, for example. In this paper, Harris and Schuchert and Mayfield, they talk about genetic factors influencing alcohol dependence. And we know from research at this point that if the parents have got alcohol problem, then the child is probably more likely to have too. But the question is that genetic or is it behavioural? I don't know. I don't know enough to make the distinction. I don't think anybody else does, but we can all make a case for one or the other or all. Obesity is the same. If the parents have the obese, then the child is more than likely to have obesity. Now, is that because of a gene? Now, this research paper suggests there are genes, but the gene might not be just about metabolism. It could also be the mind, how much dopamine we produce. So if I'm not producing as much dopamine as you, then maybe I'm going to seek foods that produce that to compensate for that. The depression is the same. The article by Michael Meany, the interesting fascination where the talks about depression and the genes that play a role in that. So, yeah, behavioural and psychological, but equally we need to sort of be open-minded. So the personal trainer says, just get up and train, go. Well, actually, you don't quite know, and do the math, and as you do, because it's dangerous to lose information sometimes. I had a parent one time come to see me. She booked a session in for her daughter to see me. It was for the examination coming up. She said, my daughter's got an examination. Can you help her? She's anxious. She's a bit anxious. I said, yeah, for sure. Bring her down. So she brings her down. And she sat literally in my room there. And then all of a sudden, the dynamic changed. I think my daughter's got ADHD and autism. I said, whoa. Now, I'd worked in education in care home. In the care home, there were young people with autism and Asperger's and other conditions too, if you want to call them condition. But equally, she's like, okay, I think. And I said, how do you know? Well, I read the Sunday Times supplement. I said, what? WTF? I shan't swear in this wonderful company. I'm thinking, wow, you read the Sunday Times and you've diagnosed. I said, have you not got a professional diagnose? No, I just know. I said, wow. I said, well, what do you want me to do? And she goes, help her. I said, wow. I said, who do you think I am? Just because I've got long hair and a beard, I'm not a miracle worker. We know that people with long hairs and beards are being classed as miracle workers. I'm not one of those. I'm just a mere mortal. Everybody else. Okay, I am trying something new, by the way, in my peak mental state seminars. Tony Robbins is the fire walk. I'm trying the water work. I'm laying out water, and then people can walk across water. That's my big thing. And if you can walk across water, then we've cracked it.
When you can do that, we're in.
Yeah, definitely. You better believe it. Definitely. You'll be my first. My first big.
You'll be shocked when I do.
Yeah, precisely. Definitely. There we go. I could start with drinking a few more cups of water a day. I do, but it's coffee. That's water anyway. So I have my 8 cups of water a day. It's just got chemicals in there. But the point being is that, it's not easy. I don't want to sort of like throw it out there, and I think that I really think it's important for coaches. I think coaches should do safeguarding. And before you think I'm trying to flog you a course in safeguarding, I don't have a course in safeguarding, but I might write one. I think you can get one for free, I'm not sure. People probably know more than me. But I think it's useful to have that. Because I think that, it's useful. Coaching is not regulated, by the way. Not at least in this country or a lot of the countries that I work in. And I think that it's got to move forward. The fitness industry has, and coaching for me is just, it's dragging its heels. I really think it's important that there is an element of safeguarding, because there's vulnerable people out there. There are people, they mean well. They don't mean anything by it. They just have their own perception. And the woman bringing her daughter in, saying, "Can you do this?" And I'm like, wow. And on top of that, the conversations unfold, and she goes, "Well, she has a weight issue too." I'm like, flipping heck, it's like 14, 15 years old. What have I got myself into here? I thought, as you do, and I just said nothing, as one does. And afterwards, as we're leaving the room, I got a card out. I said, "I know a psychiatrist down the road. You might want to see him." Should I take her to see him? No, not her. You need the damn help. But I didn't want to sort of like embarrass her in front of her. What did you do? But I did email afterwards saying, "Well, I think maybe you need more treatment as it is." But such is life. And for example, say, I don't want to go on about it, but we talk about gene, and one thing I learned in a lecture from Francesca Happy at King's was about for example autism. So there is twin and family studies that show that autism it could be heritable. In minority of cases, a rare single gene mutation, but for most it's expected to be polygenic. It's caused by many genes that have a small effect. So it is a neurodevelopment condition, but there's no biological condition to test for it. So you go off behaviour, and the behaviour is under DCM-5. The criteria is under DCM-5, but equally you could argue that criteria on any given day, we all have traits. Okay, well certainly I do, I can't speak for you, but equally in saying that, there is a spectrum. So you could have someone who has got the diagnosis that could, equally you wouldn't know. That could be a professor or a college teacher, but equally someone else could have far more challenges. But from one point of view, you said to someone with autism, for example, okay, we're going surfing on the bus. They might think literally surfing on the bus rather than going surfing. But the way I speak, you probably would think you are surfing on the bus by my language. But the point being, and the reason I say that is because, with all these things, there's many theories. For example, you've got social motivation account, mirror neuron theory, mind account, and other theories. A theory is only an idea. Okay, theory is only an idea, and I know, when I started working in care home, and even in schools, teachers would struggle. There was no need for them to struggle as much as they struggled. All it would take is for someone to come in who specialises in a specific area, and would help a lot. Just an awareness, a bit of an understanding, and I'm not the person to do it because it's not my area, but there are people out there that would really help. We've got to move on with the times now. We have a lot of technology. We know a lot now. We need to move on and help. Because I think, for me, in my experience, I used to see teachers really struggle. It would make their life easier to understand a little bit more about certain things. Not to be the expert, but just know a bit more. It would solve a few issues. You sort of know enough to know to diffuse situations. You know, in my opinion, when I studied education, there are certain things that could have been prevented. You know, not trying to be, smarty pants and I have all the answers, whatever. And I'm not an expert in it anyway, but I've studied as much as I can, and at least to sort of know what I can do. But it needs to be more formalised. That's not only for that, for other things too. Because if you're sort of basing stuff on just the manual itself or the Sunday Times supplement, then it's not really a good idea, is it? From that point of view. But I want you to think about it this way, from this perspective. So you could take a child, and a child could be born with all the best genes in one respect for adaptive behaviour. But equally, you could take that child and you can put him in an environment with two parents who are wonderful parents, wonderful family. Okay? And you'd like to think that statistically, based on theorem, they're going to go on to do pretty well. And they probably would do, and I know if I had the choice, I'd rather be in that environment. But equally in saying that, we know it doesn't work that way. But the other side too, if that child's taken away at 2-year-old by a local gangster who can't have a child and wants a child, and then is brought up in a world of violence, do you not think it's going to be a different outcome? It could be. So psychology plays a difference too. So psychological influence may include emotions, attitude, self-control, learning association that we create, changes in behaviour, our cognition, the way we process information. So all these things are psychological that impact our behaviour wellness. Social factors include family, peer group, economic status. Social factors that can impact our behaviour and well-being as well. So what do? They all interact in a way that contributes to an individual's health and health behaviour. So what we're saying here is about being holistic. The model is really complex, by the way, and I'm only touching the surface, and that's one argument for it. But one thing I do think is quite useful, in my point of view, is understanding that they all combine. So there's interaction between psychological, social, and various factors that can combine all together. Human being is quite a complex system. I think by being aware of that, we realise none of these factors alone explain behaviour or health behaviour, because the model is obviously transferable to many different things and so on and so forth. But equally, we become more well aware. We understand what we can do to help the person. We understand, and we can understand where they might need other help. So for me, most importantly, it overcomes the reductionist approach. Those who try explain behaviour solely from biology, psychology, or sociology. So, depending on your professional perspective, if someone has a problem with alcohol, smoking, anxiety, depression, you're going to favour a certain approach. And the danger is, for me, you can be blinded by something that might contribute towards that. Depending on your profession, you're going to have an answer. And your answer might be the right one, it might be the effective one, but it might not be also. So if you're a medical person, for example, a doctor may think smoking, alcohol, anxiety is genetic and decide biological intervention is necessary. They might go down the Medicaid road. And I'm not for or against medication, because I'm not qualified to comment on that. But what I would say, it'd be a very limited view to think that other things don't contribute. So I'd like to see more interaction between the medical field and the psychological field, the coaching field even, and sort of more cross discussions about things, because equally in saying that, you could debate, and I'm not, one thing or the other, but equally, so the doctor may think from a reductionist point of view, but they might not think that. They might have the open mind too and suggest that the person do get help, but that's sort of in that system. A psychologist may believe that someone who drinks excessively because they want to escape from depression, anxiety, they may treat someone who's got alcohol problem, depression, cognitively. Smoke could be a coping strategy. Anxiety could be a coping strategy. So it could be cognitive, forced appraisal situation. Okay, so they may treat it and think it's a mind thing, but it may not be that. It may come back to this. It could be. It's very likely to be a combination of all factors, a cocktail, and it's very likely that it's not one thing or the other. But it's also important that we sort of understand what we can bring to the party. Hence, when people email me to do some session, so I mentioned the pain relief sessions I do in hypnosis. Then the first thing I say is go see a doctor first, because I'm not that. I don't understand. I don't have the biological perspective, and go see the doctor first, because it could be a pain is a sign of knocking on the door. It could be a problem that needs treated, and when I trained the chiropractors in NLP hypnosis a couple of years ago, I said that the pain, maybe they should go see the doctor first, because in 6 months if they've got the tumour, what are you going to do then? You put it down to what you think it might be, but then it's too late then maybe. They could have got the help they need. Okay? So for me, it's having the open mind. And the sociologists might think that anxiety, the smoke, environment, could be down to the social networks. Change the environment, social factors, and that changes. That could be that too. So which solution is correct? Well, all might be correct to a degree, but none of these responses addresses the complete problem. Okay. One thing I would say, by the way, when I talk about reductionism in the area, that's not just applying it to the medical people, to the psychological people, to sociology, or anyone for that matter. This could be anything. And I had this discussion one time with someone who talked about the chakra balancing, and they said they were holistic. They said a holistic approach, and they had a go at the conventional medicine, saying that's reduction. And I said, well, hang on. I'm not the medical person, but you having a go other fields, explain. And they explained the chakra. I said, well, you're not really holistic. You're reduction, because you're putting it down to one thing. And if you fix this, that happens. I said, what about if the person that just lost a parent, if they lost their job, a social factor? You can fix all the chakras you want in the world. If they lost a job and they got no money to pay the bills, what if they lost the bereavement, psychological thing? What if they had an accident and damaged part of their brain? Your chakra's not going to fix anything then, is it? You can stick your chakras if that's the case. So, and I'm dismissing anything, and I'm more holistic. I'm holistic. I when I worked in sport, I used to bring in Reiki people, EFT people, anyone I could, even if there wasn't the scientific evidence clinically, because I know clinical trials can be quite limiting in themselves anyway, the open mind, but equally I always think, well, we can't make the big claim. So the reductionist, you isolate it down to one thing, and we know that there's multi-factors. Okay? So to a degree, so the model, for all its challenges in one respect, it attempts to analyse health and health behaviour from the biological, psychological, and social perspective. Simultaneously, there are more thorough explanations of behaviour and more complete effective interventions. We can help people. What is our goal? Our goal is to help people best we can. Okay? Our goal is not to put, like you see, some therapies, one has a go at the other. Mine is better than yours. mine is this is that. That's not the goal. People say to me, you've done so many different modalities, which ones do you favour? Well, in my personal opinion, the building block for a lot of what I do is hypnosis. But that's my preference. But it's not panacea. It's not the be-all end-all. There's many other things too that are quite useful and probably more appropriate to certain situations. Hypnosis is not appropriate to everything. So the point being is that, okay, there's some things we can't explain. But not to say clinical trials are the be-all end-all, because anecdote is useful. We should study more people who got better. If someone gets better, we should spend more time studying people who got better. But clinical trials sometimes can limit that. But there's the chicken or the egg too. Because if someone gets better through doing a therapy, is it the therapy or is it them just getting better? So someone does CBT for anxiety, is it the CBT that treats the distorted thinking, or is it the person just gets better for realising? Who knows? That no one can prove. So the biopsychosocial model takes into account that there's no one discipline that has all the answers. Rather, perspectives and approaches and methods from various disciplines that contribute to analysis, understanding human behaviour. Okay? And we use the example. So I mentioned before, one time I was on a course and this woman said that she had anxiety and she took a B12. She took the B12 and that helped her a lot. I can't prove that was the case. I don't think she can prove it either. Anyone can prove it, but that worked for her. I was treating someone once for anxiety, performance anxiety, for the presentation. She had a lot of anxiety. And she'd seen other therapists. She had to go other coaches. She had to go to other coaches and therapists saying none of us worked. None of them worked. They've all failed me. I still feel anxious. I thought, that's a little bit strange. Some great people you've seen. I don't think I can do any more than what they're doing. I looked at what she'd already done. And I sat down and I thought, okay, I have a hunch now. I said, okay, I have a hunch. And I said, well, what about your nutrition? She goes, what's that got to do with it? I said, if you go away for 1 week and write down where you have nutrition, I'm not a nutrition expert, but I know enough to know if I can maybe send you somewhere. Comes back, having 16 cups of coffee a day. I said, flip a heck. You're having 16 cups a day. What's that got to do with anxiety? You don't know what you're talking about. I said, well, okay. What I did do is I said, you know what, I'll do experiment with you. I'll do the blood pressure monitor and the heart rate, and then you drink 2 cups of coffee, I'll do again. And the blood pressure went up and the heart rate went up. I said, there you go. Go see someone. I said, it doesn't matter how much cognitive work you do, maybe it's unlikely if you're going to drink that many cups, it's going to do anything. So that's sort of pushing the picture. From that point of coaching point of view, then the other therapist, maybe it wasn't so much them. All I did a little bit different to them was, okay, let's get a bigger picture here. And that seemed to have done the job. But that was another issue for another day that we dealt with. Okay. Is that sort of, we make sense there? Yeah. Okay. So it's sort of a holistic approach. We should all work together. If you have good networks of people around you, then you can help the person do what they have to do. It's just like I mentioned that the mindfulness is great, but it might not be appropriate to everybody. Some people are not ready to be mindful because they can't escape their own thought. Another consideration we mentioned before about the reductionism, so we get multifactorial. So build good networks with people, other people. Be very clear about, and I know there's different boards and associations, and in coaching you got many self-regulated boards. NLP, there's many self-regulated boards. In the UK, hypnosis, there's many self-regulated boards. None are regulated in the sense that, okay, this is the given, but I think it's sensible to stick to a code of ethic, okay, and be very clear about what one does, and do take it in consideration that things are multifactorial. A single cause is very unlikely, at least in the way I understand certain things tend to work. So you want to be really holistic and uncover every stone. Okay, it's worth taking that in consideration and knowing where you fit in. Okay, knowing where you fit in, knowing where you decide you're going to give any advice, if anything. Okay, I'm not going to give someone advice in an area that doesn't fit in with my remit because I'm not the best person to do it. I might be bound by my limitations. I might not. But for me, it's okay, you go see the appropriate person for that, whatever that may be. Okay? So I'm going to decide what is what. You know, if someone comes to me, see me for anxiety, for presentation, okay, have you seen a doctor for anxiety? Have you seen a psychologist? Are you seeing a psychologist now? What do they think of you working with me if you are? Okay? And so on and so forth. Okay? And sort of to reiterate that the complexity of multifactorial accounts, the system, open system, predictions are difficult to make. It looks great when you sort of go to some of these motivational seminars and someone sort of sits in the chair and the person revolutionised this person. And that's resistance in itself, by the way. Compliance is resistance. If you've paid a few £100, if not even more, to go to a seminar, thousands of pounds, and someone asks you to come up and volunteer, you're hardly going to say, it didn't work for me. And if you do, the motivational person will say, well, you're hopeless then, get back there. And I've seen that one time, years ago, I went to this motivational seminar. I won't mention the name, and the person turned up and she had some sort of issue, and he's like, how do you feel now? And she's like, no difference. Well, you don't want to get better. Fuck off. I'm like, said those words. I thought, bloody hell. I'm like, I'm hiding here. He's like this. I'm going outside the room. Scary people in this world, man. Chill, dude. You know? It's all good. Your ego might have been blown a bit, but no worries. So if I ask you to volunteer to do a demonstration, if it's not worked for you, then tell me. I'm not going to have a go on you guys. But the point being is that, you know, yeah, you sort of get the picture. So I think over-compliance can be quite, you know, and it looks good on paper. Well, I've seen such and such do that and whatever. You know, one person emails me, for example, says to me, you know, can you help me? I got a fear of the motorway driving, and I said, okay, you're getting help for it? No, I'm not getting help for it. Well, maybe you want to get some professional help for it before you come and see me, but I want to work with you, Jim. I you know, I've heard what you do, and so what exactly have you heard what I do? And he said, how long will it take for you to sort me out so I can drive off motorway again? I said, I don't know. I don't know what the issue is. You come see me first, then I'll talk about it. Let me know you've seen what you're doing about it. He sends me an email going back. I spoke to someone who said they can erase my emotion. They can erase your emotion. That's not technology I've come across yet. Go see them if that's the case. You've got your emotions erased. It's a bit like the person who phones me up and says, I've just broken up with my girlfriend. You're the hypnotherapist. Wipe her out of my mind. Wipe her out. Get her out of my mind. You know, in January you get the call. It doesn't stop ringing the phone for weight reduction. You're an hypnotherapist. Like I've got a magic wand, you're going to turn up and you're going to lose weight like that. It don't work that way. I can deal with the emotional issues around your eating. And if you see a nutritionist, I'll probably put in a sensible eating plan because the math is quite simple. And you probably want to lose it in a sustainable way, like a couple of pounds a week or 1 pound a week, depending on how much you want to lose and what time frame. If you don't put the weight on in 2 weeks, you're probably not going to lose it in 2 weeks. I don't have a magic wand where you go to bed at night, wake up in the morning and better. They don't want to hear that. Well, I believe someone else can do it. Well, go see someone else then. So the point being is that, you know, there's got to be a sense of, you know, because we live in a world these days, the digital age is great. You can share information, we can all keep in touch. It's wonderful. But equally, it's a mechanism for people who a little bit of knowledge. It can be a dangerous thing too, you know. So the guide for the scientific approach is the biopsychosocial. The guide is there, you know. It's the complexity. Health behaviour is hard to understand because, from this point of view anyway, because there's no straight line. There's no straight line. That's the hardest point. So this model has limitations because you can't really draw a straight line. This is that, this is whatever. Okay? Causality, you know, is difficult to imply. Take this and this will be that. Okay? And you know, in the medical field, if someone has an infection, then generally speaking, what do they give them? Antibiotic. And that generally, okay, this causes this, whatever, and it tends to work in that field. The behaviour in the mind is a different ball game in view of that, albeit for me, in my opinion, I think what happens a lot is people tend to treat people like they would a mechanic treats a car. Just reprogram my head, just sort my head out. Like the computer, take one part out, put one in. The brain doesn't quite work that way. Okay? And the terminology that tends to be used tends to be influenced by the order of the day. So technology, and I mentioned hypnosis, the Renaissance in World War II was influenced by, I believe, anesthetic. And you're going under, and when you go under, you're going to be this. And I think that was anesthetic in the medical field. Now it's computers, I think. Reprogramming and you're going to think, well, you've got a process you put together called cognitive reprocessing. Yeah, you're right. And it paid me to do it. And the reason why I did it was because I'm doing a seminar one time to neurophysiotherapist, and said to me, what do? You do all these different things, but we can't pinpoint what you do with the clients you work with. I said, I don't know. I just design a therapy for everyone I work with. I do what's appropriate. Tell us what you do. I thought it'd probably take me an essay to write it. So it's cognitive, and it's a reprogramming process. And I thought, damn, why don't I use that damn word? But I thought it's going to save me writing an essay about it. So you can do the diagram. You'll see the overlapping elements of each factors, which are key. To surmise, before we have a breather, any health behaviour likely to be biological factors, genetic, trauma, things we've discussed. Okay. Psychological circle involves schemas, associations. We've talked about little Albert experiment, the Bobo doll experiments, all these things we talked about that prove that there's an influence psychologically to behaviour, abandonment, all these things. The social could be the environment, what's happening in your world, the people you're around, the way you live, the job loss, divorce, all these things can combine and amalgamate. So I think that, for me, going forward, everyone's in different professions in this group, and everyone's on their own journey. And we widen the radar as we go along on our journey. And one's not suggesting to be bound by limitation, but one's suggesting that 2 minds are better than 1, 10 are better than 1. The more you've got the people around to bounce, and the more every field comes together rather than try and dismiss each other and who's better than who and what is what, the more dialogue you've got. For me, one of the best things I experienced in my mind, on my journey of learning many, many modalities, my lifelong learning journey, I can honestly say one of the most powerful things I learned to do, more powerful than anything else, I believe, in my opinion, for me, was the power of being able to sit and meditate, introspect and reflect. How wonderful that was. Every technique I've learned for many years, across many areas, the beauty of finally being able to master, just being, and being at one, and overcoming my own things in my own mind, and breathing, the sense of introspection, the power of that. Now, we all get there in our own way, and everyone's journey is different to everybody else, but there's a true sense of bliss in doing that. But equally, I believe in experiential activities to make shifts in people. I think didactic is useful to a point, but it seems to be the big thing these days. But equally, we know that we process emotion. Emotion plays a big part in behaviour, and we can resynthesize the internal parts of our mind by emotional experiential shifts, as well as task activities. So when we do work with people, things like anecdotes, humour, not my humour because it's not very good, but if you've got good humour, it can be quite useful. All these things can be quite useful. The other things you can do is the hypnosis, doing the experiential stuff. Getting people out there doing activities is quite useful too. But whilst you're doing all that, I think it's worth to consider, what is my role? I'm a manager at an organisation, I'm a coach, I'm a therapist, you could be a psychiatrist, a psychologist. So be very clear about what your role is and what it entails and how it fits into your remit. I think that's really important to take note of that. And I'm not suggesting you have to learn the model, but maybe passively from the outside you can have a look at the model. And if nothing else, to give you an idea that, okay, there's more than one reason. And what I'm doing might be useful, and the person might find use out of it, but there is a bigger picture. And holistic for me, true holism is the way forward. At least the way I see the world. We can be truly holistic and uncover every stone. And where we're comfortable and confident, have the capacity to do what we do and the remit allows us to do it, then we do. Where we think someone else is a better place to do it, see it as a opportunity, okay? An opportunity to learn. You know, I've had people who've been referred to me. I tend to be last chance for Lou for some reason. I don't know why. It's just worked out that way over time. But equally, you know what? I refer people to other people too. If I don't think I'm the right person to help that person. But equally, sometimes they come back, and it's about dialogue. So I'd like to think this has been an educational experience for you. I'm mindful of lunch again. We're encroaching lunch, and the sun is out. You might want to go for a walk now and decompress and go from there. So we